So one of the more common symptoms that people call me in a panic with is wheezing. So before we go any farther, I'm going to tell you that most of the conversations that I have about wheezing, the child isn't actually wheezing. So first, let's get wheezing defined. So what is the sound? Well, the most common reason why people call me and think it's wheezing is this sound. That is not a wheeze. That's actually mucus in the back of your throat that's moving up and down as you're taking a breath. This is going to especially happen with little children, like babies, when they have a cold and they're laying down. But it can really happen with anybody. I mean, take your husband when they're snoring. Chances are they have a little bit of that sound too, just from spit in the back of their mouth. But a wheeze is going to sound like this. And this makes us worry about asthma or pneumonia. So if your child has a true wheeze, and they're having problems breathing, you need to see the doctor. If this has happened in the middle of the night and your child doesn't have a known diagnosis of asthma and they're breathing fast and having problems breathing, this is one of the few reasons you need to go to the emergency room, and you need to get there fairly quickly. If you're during the day and you're having this, or they've made it through the night, this is a reason to go see the doctor. Now let's say you have asthma. You know your child has a wheezing problem. Should you hold off on giving their albuterol medicine? Absolutely not. If you hear wheezing, go ahead and give it. But always remember with asthma and albuterol is that albuterol is really an emergency medicine. It's a crutch, if you will. It's not taking care of the underlying inflammation of asthma. So if you hear wheezing and you have an asthmatic child, definitely give some albuterol. But go ahead and plan on the next day going to see your doctor. Now if you know you have asthma and you've given that breathing treatment and you don't see any improvement, they're still wheezing and having problems breathing, you may want to give a second albuterol. You definitely want to touch base with your on-call doctor. Give a second albuterol. If you're still not seeing improvement, again, this is a time to go see the emergency room. Remember, every year kids die from asthma. It's something to definitely take serious. So wheezing, true wheezing, is something you need to get your attention and watch for. The other thing is, don't think about wheezing as coming in. Now that can happen if you get bad enough, but if you're only hearing that sound when it comes in, that's a different condition. That's stridor, and we think croup. Again, can be something that you worry about, and if it persists, go to the emergency room. But if you have a child that has asthma and the only sound they're making is when they breathe in and you don't have the response with albuterol, chances are you're not having an asthma attack. You're probably having an attack of acute croup. Again, if they persist with that breathing, go see the emergency room. But wheezing, it should always be seen by the doctor, either at night in the emergency room if you're having problems and you can't get better, or make sure that you go see us the next day.